Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Very glad that you could join us today. Our guest in studio this afternoon is Doctors Mark Sherwood and his wife, Dr. Michele Sherwood, both of which practicing in Tulsa, Oklahoma at the Functional Medical Institute, a wellness-based medical practice there in Tulsa. And they've also authored the brand new book, The Quest for Wellness, a practical and personal wellness plan for optimum health in your body, mind, emotions, and spirit. Welcome to Health Professional Radio, Mark and Michele.
Thank you so much for having us, Neal. We really appreciate it.
We're glad to be here.
Great. You know, we were talking before when you were here in studio with us in other segments about the quest for wellness and your philosophy, I guess, to healing. Both you and your wife, well versed in naturopathy, and you, Michele, you're also an osteopathic specialist as well, yeah?
Yes, I'm an internal medicine board certified, sports medicine board certified physician / osteopath.
Yeah. So when I come to see you, I'm going to be totally confident that you're going to be able to help me out.
You bet.
Absolutely. And
we're confident as well.
Yeah, and your background is varied as well, Mark. 24-year veteran of the police department there in Tulsa on the SWAT team, a ex-pro baseball player, motivational speaker, and evangelist. Being an evangelist and a medical practitioner, do you find that one helps the other more or less, or is it just a very good mix? Talk about being a minister and a medical practitioner.
Yeah, the idea of being a minister and a practitioner, they really do merge as one and the same. I mean, it doesn't matter, really what a person believes. I mean, in our belief paradigm, we believe that, God is the ultimate healer, and we become agents or messengers of that healing. Mm-hmm. So the spiritual healing goes hand in hand with the physical healing, and we believe in miracles. Even if you don't believe as we believe in that, we all cannot deny that supernatural healings and miracles occur. You know, I was watching television recently and heard about a young man who pled and even prayed over his father who had just died, and he'd been dead for 45 minutes and already pronounced. And, miraculously, with no explanation from a medical perspective, the man's heartbeat began, and he is alive today to tell about it. So we believe that there is that spiritual, miraculous component to this, and certainly being a minister and an evangelist, it fits, and it never should have been separated from the idea of being a physician / healer.
You know, in interviewing health practitioners pretty much daily, I have learned that there was a time when the spiritual aspect was more important than the physical aspect when it came to trying to heal someone or at least find out what was wrong with them. In I guess a profit-driven system of healthcare, we've begun to care less about health and more about what we can gain monetarily. It doesn't seem to be the same when we're talking about natural healing. In your opinion, Dr. Michele, why do you think that natural healing modalities seem to be far less driven from a financial aspect?
Well, to answer your question, there's less money behind it because it takes more time. You've got to slow down a little bit, and you've got to listen into the life of the person that's in front of you, and you've actually got to vet them out a plan. And just in the general system, you're just seeing 40 patients a day, going as fast as you can, just trying to get secondary ancillary services done and quick, and you're missing the patient. By the time the end of the week comes, you don't even know the name of the patient, but you know the name of the disease. So in natural healing, we have to slow down, which we all really should do anyway, to pay attention to who's sitting in front of us.
Now, I'm going to ask a question, Dr. Michele, and I'm asking for a reason. Just give me a short list of the services that you offer at the Functional Medical Institute.
Well, we do the internal medicine, sports medicine piece, which is general-based medicine.
Mm-hmm.
And then based on the person's needs or desires, we'll move them into the wellness-based practice, which that's where, Dr. Mark and my other practitioners come in and they work with the patient one-on-one to see where are the breakdowns. Are they in the physical, intellectual, emotional, or in spiritual components? And where do we need to go to work with? Do we need to go to nutrition and use our DNA, or do we need to go to bioidentical hormone therapy? Mm-hmm. So we've got a whole array of things to do with the patient to set them up for success.
Now, does your book have testimonials in there?
Yes, it does. And I think the testimonials are what really drive it, because people want to know if it works, but the book is interdispersed with various testimonials from our own experiences in life to patients' experiences. And of course we use fictitious names with the patients, but they're real stories, real deals, and real life. And I think that's the appeal of it.
Now, I asked for the list of services and the testimonials. So you've got a long list. You didn't even touch the surface of everything that you offer. And you've got testimonials. So you've got some proof that it works. It seems that offering these services in the way that you do is much more efficient. Would you say that efficiency, because you're seeking total healing, is the result as opposed to what we find in traditional medicine?
Totally agree with what you said, because we had these services with the DNA testing, the bioidentical hormones, all of the other testings that we have, the bioimpedance machine for body composition. These things are all used to accomplish an end, the end being the patient getting well. We don't just do these services to generate income as ancillary products. We look at them as tools that are to be applied appropriately and efficiently to give the best result for the patient. That patient being healthy, that patient having normal body composition, which is defined as not excessive body fat and appropriate level of muscle tissue, and they are walking out of here with their time with us relatively pain-free and relatively free of unnecessary use of medications.
Talk about bioidentical hormone therapy.
Well, I didn't become a hormone expert because I love hormones. I became a hormone expert because my patients begged me to help them. And when I was in traditional medicine, of course, hormones were like the bad place to go. But with the patients that would come to me because their life was falling apart, their marriages were falling apart, they were depressed all the time, they were hot flashing, night sweating, brain fogging, miserable, I was like, okay, I'll step over the edge and see if I can help outside of the box and see if I can help them. Well, bioidentical hormone therapy is hormone therapy that is set up to administer hormones to the system that are as close to what the body makes as God designed it. I'm not a practitioner that's going to say there is no compromise or no risk to utilizing bioidentical hormones, but it is much less and use less, and the system thrives when hormones are in balance. We see people get their lives back. We see, emotional wrecks become stable, and it's not with antidepressants and psychiatric medications. It's actually with bioidentical hormone balance.
So the hormones that we're normally getting in traditional medicine, is the body basically trying to reject them because it doesn't recognize them as something, familiar to it, and we have to basically force the body to accept it? Whereas in what you're talking about, bioidentical hormone therapy, are we getting these hormones from other people, or how does that happen?
Well, that's a very gentle way to put it. The way you put it about is the body rejecting it. Well, the body doesn't see it as normal. The body doesn't see it as what it naturally makes. So the serum levels aren't actually going to change like they do with bioidentical hormone therapy because it's so similar to the system, it's less likely to reject it, if you will. And these hormones, these bioidentical hormones, they actually come from plants. Mother Nature's natural substance plants help us derive bioidentical hormone therapy.
Is this something that you recommend, right off the bat as sort of a staple of the whole healing, or are some people not candidates at all for any type of hormone treatment or therapy?
That is a fantastic area to explore, because in our practice, a patient may come to me wanting hormones because they see that that's what we do. Mm-hmm. What we look for is we look for the right system at the right time to put those hormones on board. And what we find is that often, if we will change the lifestyle piece and get the standard American diet under control, that system will get well, and those biomarkers of health will correct themselves, and those hormones will come into balance. Now, if someone is obviously of age and the likelihood of regaining that balance is not there, we may start hormone therapy while we do lifestyle change. But it's very personable. It's very personal. It depends on who is sitting in that chair and what their whole health history is and what their assessment shakes out to be, whether or not we go to hormones as our first go-to or as part of our plan, or after we've done the plan, we may add hormones.
In wrapping up, your book, it has phases, 3 phases in your book, The Quest for Wellness. In which phase does the book address breaking down some of the barriers that, say, athletes have when it comes to their body, training, their coach's philosophy about how to heal and how to treat? Because some of these ideas when it comes to sports are very different from the ideas, when you're, 20 something and you're not an athlete. How do you address that? And is it addressed in your book?
Yes, it is in all 3 areas, because we know that the continuous development of ourself, let's pertain to sports, we must continue to develop our emotions, because we know that emotions that are out of control are going to affect our performance, and our performance will not be its optimum. Mm-hmm. The intellectual piece, we need to keep learning the newest information and not think we have it all figured out, because if we learn new techniques to maximize our performance, that's always a benefit. And the essence of who we are, that spiritual piece, certainly affects the way we play the game, the way we sport, our ability to relate to other teammates. So it's more than just the physical piece. You see athletes like Stephen Curry, for example. Mm-hmm. That guy seems to have maximized all those 4 areas. And we teach a person through these 3 phases to do exactly what he seems to mimic. I've never met the man, but he seems to mimic those 4 phases in an excellent manner.
Great. Now, let our listeners know where they can pick up a copy of your book.
You can get it on Amazon.com or go to our website, and I think you mentioned that, Neal, and there are links to those various sites where our book can be picked up, whether hard copy or electronic copy.
And that is sherwoodwellness.tv/quest for wellness, yeah?
Yes, sir, correct.
All right, great. It's been a pleasure speaking with both you and Michele. Thank you so much for being here. You've been listening to Health Professional Radio, and we've been in studio talking with Dr. Mark Sherwood and Dr. Michele Sherwood about their brand new book, The Quest for Wellness, a practical and personal wellness plan for optimum health in your body, mind, emotions, and spirit. And we've also been talking about some of the ways that people can, reverse the bad habits that they have when it comes to eating and nutrition, and also the importance of looking at the whole person. So thank you so much for both of you joining us today.
Neal, thanks for having us. We really appreciate it.
Glad to be here.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.